everyone, welcome to Module 10 Synopsis, Vulnerable Populations. Look over the module objectives for Module 10, make sure you feel like you've met all of them. If you haven't, go back through some of the lessons and see if there's anything that can help you make those connections. In pursuit of which objective did you learn the most? Vulnerable populations are groups of individuals who are at an increased risk for health problems and health disparities. Health disparities are health differences linked with social, economic, and/or environmental disadvantages. Examples of vulnerable populations are very young and very old, chronic illness, disabilities, communication barriers, veterans, racial and ethnic minorities, the LGBTQIA+ communities, migrant workers, rural Americans, chronic mental health disorders, and homeless. So, health equity is defined by the U.S. Department of Health and Human Services as the attainment of the highest level of health for all people, and that achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So, what are some age and developmental considerations? Children have health and developmental needs that require age-appropriate care. Development changes, dependency on others, different patterns of illness, those are all things that need to be taken into consideration. The elderly population also has unique health needs due to an increased incidence of illness and disability, as well as the complex interactions of multiple chronic illnesses and multiple medications. Children and the elderly are also vulnerable to experiencing neglect and abuse. Nurses must be aware of the signs and symptoms of neglect and abuse, and we are legally mandated to report these signs. What about chronic illness and disability? People that have chronic illnesses or disabilities are more likely than the general population to experience problems in accessing a range of healthcare services. The vulnerable groups may also experience lack of coordination of care across multiple providers. Also, people with specific chronic illnesses like mental illness or HIV can face social stigma, and it makes it challenging to seek or receive appropriate health care. Name a condition, other than the two I just noted, that is stigmatized. So let's review some things about the veteran population. That's someone who's served in the military forces. They have a higher risk for mental health disorders, substance abuse, post-traumatic stress disorders, traumatic brain injuries, and suicide compared to their civilian counterparts. Medical records of veterans reveal that 1 in 3 clients was diagnosed with at least one mental health disorder. Identifying and treating mental health disorders in veterans have the greatest potential for reducing suicide. Veterans Affairs, or the VA, provides healthcare and other benefits to individuals serving on active duty in the United States Uniformed Services. The VA is the largest healthcare network in the United States, with 1,255 plus healthcare facilities, serves 9 million enrolled veterans every year. Nurses can also refer veterans and their families to the National Alliance on Mental Health, or NAMI. There's a home front course. It's a class for families, caregivers, and friends of military service members and veterans with mental health conditions. The course is designed specifically to help these individuals understand mental health disorders and improve their ability to support their service member veteran. Racial and ethnic minority populations in the United States experience significant health disparities. The U.S. Department of Health and Human Services Office of Minority Health provides minority population profiles for Black, African Americans, American, Indian, Alaskan Natives, Asian Americans, Hispanic Latinos, and Native Hawaiian Pacific Islanders. Profiles and information, full census reports are on the site for the U.S. Department of Health and Human Services if you want to take a look. Nurses can access these profiles to view healthcare statistics regarding how populations and services are available in their communities. One of the reasons that I recommend you doing that is it's part of us being aware of the current state of healthcare and how these percentages and populations vary over time and they grow. And it's very important for us to not only be aware of the disparities of the racial and ethnic minorities, but to also be advocates and to be in support of programs and policies that help eliminate these healthcare disparities. We just discussed two different vulnerable populations. Give me one commonality between the two related to healthcare disparities. The LGBTQIA+ population encompasses all races and ethnicities, religions, and social classes. Research suggests that these individuals experience health disparities linked to social stigmas, discrimination, and denial of their civil rights. The population experiences high rates of mental health disorders, substance abuse, suicide, and experiences of violence and victimization are frequent. These individuals can experience long ranging and long lasting issues from this. Community efforts to improve the health are training professionals to appropriately inquire and support clients' sexual orientation, gender identity, and to promote regular use of health services, training healthcare professionals and students regarding culturally competent care, providing supportive social services to reduce suicide and homelessness among youth, and curbing sexually transmitted infections and HIV virus transmission. Human trafficking victims are forced to work or provide commercial sex against their will in legal business settings and underground markets. The International Labor Organization estimates that there are 40.3 million victims of human trafficking globally. Victims are men, women, adolescents, and children. Experts estimate that there is 100,000 incidents of sexual exploitation of minors that occur each year just in the United States. Human trafficking victims have been identified in cities, suburbs, rural areas in all 50 states and Washington, D.C. There's a widespread lack of awareness and understanding of trafficking, and this leads to low levels of victim identification. When when children run away or youth are homeless, they're at a higher risk. So are foreign nationals and individuals with a prior history of experiencing violence or abuse. Foreign nationals who are trafficked within the United States face unique challenges. Recruiters located in some home countries frequently require large recruitment and travel fees that victims become highly indebted to them and can't leave their recruiters or traffickers. People who've experienced violence and trauma in the past are more vulnerable to future exploitation because the psychological effect of trauma is often long lasting and challenging to overcome. Victims of domestic violence, sexual assault, war, or social discrimination may be targeted by traffickers who recognize the vulnerabilities left by this prior abuse. Yet some of the services available to victims of human trafficking and that they may need are emergency services, crisis intervention and counseling, emergency shelter and referrals, urgent medical care, safety planning, food, and clothing. What is one thing you can do right now as a nursing student to support or advocate for one of the last two vulnerable populations? There are well over 2 million people in U.S. prisons and jails, with nationwide incarceration rates of 810 inmates for every 100,000 adults. Higher rates of incarceration are seen among racial and ethnic minorities and people with lower levels of education. The United States incarcerates a larger share of its population than any other country in the world. Many of the people in jail have chronic health conditions, including mental illness and addiction. Over half of all inmates have a mental health disorder, and female inmates have higher rates of post-traumatic stress disorder than the general population. Healthcare is considered a constitutional right for prisoners. Nurses working in correctional facilities have a legal and ethical obligation to respond to requests for care. If an inmate's safety complaints are ignored, safety risks are not removed, or if there is failure to provide proper medical attention, it is considered deliberate indifference. Correctional nurses have a duty to evaluate prisoners' health needs and determine the level of care required. It's critical for us to also understand the impact that incarceration has on family members and communities. It's while they're incarcerated and after their release. Community health is affected by incarceration due to economic impacts and long term impacts on children's health and mental health. This is actually considered an adverse childhood event when you have a parent or close loved one that is incarcerated. An example is children of incarcerated parents are more likely to live in poverty, as well as have higher rates of learning disabilities, developmental delays, speech language problems, attention disorders, aggressive behaviors, and drug and alcohol use. Family centered services for incarcerated parents and their children focus on parenting programs, family strengthening activities, nurturing of family relationships, and community support for families during incarceration and following release. Rural Americans are another group that experiences significant health disparities. Rural risk factors for health disparities include geographic location, lower socioeconomic status, higher rates of health risk behaviors, limited access to healthcare specialists, and limited job opportunities. This inequality intensified because rural residents are less likely to have employer provided health insurance or Medicaid coverage. The Rural Health Information Hub and Rural Health Series is a resource where you can examine rural mortality and preventable deaths, health related behaviors, chronic disease, mental health services, and other related topics. The Federal Office of Rural Health Policy provides additional information regarding rural health policy, community health programs, and telehealth programs to increase the healthcare for underserved people in these communities. Two of these initiatives are the National Health Services Corps Loan Repayment Program and telehealth. And telehealth is what we'll talk a little bit about. So, this is a fairly recent initiative. It's been around for a long time, but it's been very hard to get implemented due to the cost. I know that many hospitals and large health systems have run pilot programs up until 2020. And when COVID hit, that's when they decided that they needed to make it operational and that insurance would start covering it. Um, Telehealth, it uses digital technology to deliver medical care, health education, and public health services. And obviously, it can connect people in different places. It can improve access to healthcare by delivering the services in underserved areas and remove barriers of time, distance, and provider scarcities. Nurses support clients using telehealth and provide patient education. Telehealth can risk widening disparities for some socioeconomic economic groups that have limited access to resources necessary for effective telemedicine. Nurses can help ensure that healthcare systems tailor the use of technology to meet the needs for this underserved population. What is one health disparity that the last two vulnerable populations have in common? A migrant worker is a person who moves within their home country or outside of it to pursue work. Migrant workers usually do not intend to stay permanently in the country or region in which they work. Migratory and seasonal agricultural workers, MASW, and their families face unique health challenges that can result in significant health disparities. Hazardous work environments, poverty, insufficient support systems, inadequate or unsafe housing, limited availability of clean water and septic systems, inadequate healthcare access and lack of continuity of care, lack of health insurance, cultural and language barriers, fears of using healthcare due to immigration status, lack of transportation. MSAW populations experience serious health problems, including diabetes, malnutrition, depression, substance use, infectious disease, pesticide poisoning, and injuries from work related machinery. These critical health issues are exacerbated by the migratory culture of this population group that increases their isolation and makes it very difficult for them to maintain treatment regimens and track health records. There's some strategies you can use to support the health services for migrant workers. Culturally sensitive health education and outreach, education materials that are appropriate at literacy level, portable medical records and case management, mobile medical units, transportation services, and translation services. What is a health disparity specific to migrant workers? Homelessness can significantly affect an individual's health in three ways: health problems caused by homelessness, health problems that cause homelessness, and health conditions that are difficult to treat because of homelessness. As a result, the average age of death among homeless people is the mid 50s. They face multiple barriers to healthcare, including transportation, fragmentation of health services, difficulty scheduling and keeping appointments, stigma of homelessness, lack of trust, social isolation, and significant basic physiological needs. Effective health care for the homeless population addresses the social determinants of health, such as housing, income, food, and social supports. There's a medical home model developed by the Veterans Health Administration that's an active communication and coordination model among providers. You take a look at figure 17.1 in your text, it goes over that, and then right above that is a nice continuum of care. Take a look at that, get an idea of what this model is all about and how it can apply and help in the homeless population. What is the one characteristic of the medical home model that you feel is the most vital in caring for the homeless? 1 in 5 American adults experiences some form of mental illness. Despite a recent focus on mental health in America, there are still many harmful attitudes and misunderstandings surrounding mental illness that can cause people to ignore their mental health and make it harder to reach out for help. Many individuals with mental health disorders go undiagnosed. Nurses must be aware of these common signs of mental health disorders like excessive worrying and fear, excessively sad feelings, confused thinking, extreme mood changes, prolonged strong feelings of irritability or anger, avoidance of friends and social activities, difficulties understanding or relating to other people, changes in sleep habits, feeling tired and low energy, changes in eating habits, which is increased hunger or lack of appetite, and changes in sex drive. There's also disturbances to perceiving reality and inability to perceive changes in one's own feelings, overuse of substances, multiple physical ailments without obvious causes, thoughts of suicide, inability to carry out daily activities, and an intense fear of weight gain or overly concerned with appearance. Mental health conditions are also present in children. Because children are still learning how to identify and talk about thoughts and emotions, their most obvious symptoms are behavioral. Make sure that you're on the lookout for behavioral symptoms in children like changes in school performance, excessive anxiety or worry, hyperactivity, frequent nightmares, frequent disobedience or aggressiveness, and frequent temper tantrums. We as nurses we spend the most time with patients in an inpatient setting and often in an outpatient setting. It is up to us to catch these signs and symptoms of mental illness as early as possible so that we can intervene and keep things from escalating and turning into some of the more serious situations that we've talked about in this course thus far. Can you make a difference? You'll never know until you try. Great job, everybody. Keep pushing ahead.